A drug for this and a drug for that. There must be a drug for everything that ails us.
That's what we're taught in medical school.
And if you believe the pharmaceutical ads, well, pharmaceutical ads do work, and people even ignore the possible side effects. And Big Pharma increased their marketing efforts to $98 million per year just in Washington, D.C. Now, there have been efforts to curb Big Pharma from giving gifts to doctors, but according to a recent report, they've now increased their budget for doctors and other healthcare providers, as well as for grants and speaker fees and food and promotional items. Major expenditures go to hospitals and clinics and universities and organizations and direct-to-consumer ads, and the list goes on.
Well, they have a $400 billion industry, Vicki, so they can afford to spend a few billion, which they do, on advertising and promotion. They should spend as much on research and development, but they don't. In fact, they double the amount for advertising because, let's face it, what they're trying to do is sell drug. And if they're trying to sell drug, then they have to spend more time in advertising, and that's how it goes.
Well, some of these speaker fees were really surprising.
They're huge, and this was a
like
study.
$100,000 per doctor. Well, for some of the doctors a year, that's a lot. Pretty good income.
It's pretty good income. Well, this study was done at the George Washington School of Public Health and Health Services in March of 2014. And they showed what you mentioned, and they also showed that about $30.5 million, or 31% of this budget, was for doctors and hospitals and the other healthcare providers as well. And then they increased all the things that you mentioned because they found that it was profitable. And we're spending about $20 million a year on hospitals and clinics and universities, and about $11 million on doctors.
Well, they cut back a little bit, for a while, but since 2007 to 2012, there was no increase. And since 2012, that's when the increase started.
Well, it shows you that what they're trying to do is make money the way that it's been proven they can make money, which is to do direct-to-consumer ads. And even those direct-to-consumer ads that we see are ads that you look at them and go, who would want to buy that drug, when you're looking at the side effects, what they call side effects of the drugs that they're marketing.
Yeah, but it works.
Well, it works real well. And they'll continue to do that as long as it continues to work.
And what was that other study that we talked about where they the people would hear the negative effects and they didn't want to take it right away, but then later on they kind of let that go, and then they went ahead and bought it anyway.
Yeah, this was an example with selling cigarettes, okay? And what they did is they told one group about the side effects, and they didn't tell the other group about the side effects. And the group they talked about the side effects at the beginning said, no way, I'm not smoking. But 3 months later, these people who were smokers were buying the brand where they had told them what the side effects were, as bad as they were, thinking that they could trust this company more than they could trust the others. It's bizarre how we think sometimes, or don't think sometimes.
But one of the other things is that even some of their little promotional items, they found that really fosters a loyalty.
Oh, for sure. I've been invited to hundreds and hundreds of drug meetings, and during the first half of my career, I spent a lot of time going out to dinner and taking advantage of that, and they'd give me little gifts, and I'd go prescribe their drugs. It was just like a ritual. And then when I discovered some of the business practices and how Big Pharma worked, it was like I couldn't participate in that anymore. And now I don't even allow the drug reps to come into my office, and I don't carry samples of drugs in my office.
Okay, so now how does the Affordable Care Act affect Big Pharma's spending on marketing?
That's a really good question. They're going to have to disclose more of what they're doing and who they're giving money to. There's always been this game about we'd like to spend as much as we can to try and influence the doctors and their offices to be able to stock our drugs and to use those drugs. But the Affordable Care Act is now going to require that they disclose how they're spending this money.
But who are they disclosing it to, though?
Well, that's going to be to the government. It's going to be something that is published in the literature.
Oh, I thought they were disclosing it to the doctors and the hospitals.
Well, they'll disclose it to them too, but
because if they disclose it to the doctors and hospitals, they're going to feel more in debt to them.
Well, that's right. No, it'll be on a public site where the public can have access to that information, and that will tell them exactly where the dollars are going, and then it becomes more understandable why doctors are prescribing certain drugs.
And why drugs are so expensive.
Exactly. So we look at this whole topic of pharmaceutical drugs and its marketing. It's really it's a business that makes so much money that it's not surprising they spend less than 10%, okay, of what they make on marketing, which comes to billions of dollars every year. And those changes that are going to be required by the Affordable Care Act is going to change that somewhat. But good business people always know what to do, and I think we're going to have to continue to keep our eye on the pharmaceutical industries to make sure that they're not doing things that are just going to promote drugs beyond what their actual value is.